Alright, welcome to this lecture. In this video, we start with general pharmacology. And general pharmacology, what we do here is that we study the basic concept that determines the journey of a drug through the body. The basic concept that determines the journey of a drug through the body. And it is basically divided into two major parts: pharmacokinetics and pharmacodynamics. Although we also have some other parts which are pharmacogenomics. Okay, pharmacogenomics, pharmacogenetics. Those ones are also some minor part of it. But the main part of general pharmacology is pharmacokinetics and pharmacodynamics. Okay, now let's start with pharmacokinetics. What does pharmacokinetics broadly mean? It means what the body does to the drug. I believe you must have heard this definition before. What the body does to the drug. What of pharmacodynamics? Since you are seeing D here, it means what the drug does to the body. You get it now? So pharmacokinetics is what the body does to the drug. For it, the body will treat the drug as normal food, so it will be absorbed, it will be distributed, it will be metabolized, and it will be excreted. That's what the body will do to the drug. But in pharmacodynamics, we are trying to see what the drug will do to the body, and we study the response of the body to the drug. So the effect of the drug on the body, that's what we study in pharmacodynamics. Now let's start with the first one, pharmacokinetics. So like I said before, this is what the body does to the drug. Okay, so however, there's a definition for it. It is defined as the study of the time course of drug absorption, distribution, metabolism, and excretion in the body. A study of the time course of drug absorption, distribution, metabolism, and excretion from the body, and how this process will affect the concentration of the drug at each site of action. How this process of absorption, distribution, metabolism, and excretion will affect the concentration of the drug at its site of action. So from this now you can see that pharmacokinetics has four major parts: absorption, distribution, metabolism, and excretion. So we'll quickly start with absorption. What does absorption mean? Absorption simply means the movement of drug from its site of application to the blood. Simple. When drug moves from where you apply them to the drug, we said absorption has taken place. Okay, so it's defined as the movement of drug from its site of administration to the blood. Now imagine you give the patient a drug through IV route. It means that you put the drug directly into the blood. That simply means there is no absorption. Okay, so for IV route drug, there is no absorption. The drug is directly put into the blood, so there is no movement of drug from site of administration to the blood. You directly put the drug into the blood. Okay, so that is for IV route of administration. However, every other route we need to what? Pass through some barriers before getting to the blood, and those barriers are what we call cell membrane. So in every other route, whether subcutaneous route, intramuscular route, okay, topical route, they must pass through some layers of barrier. Those layers of barrier is what we call cell membrane, because cell membrane is a major barrier. Okay, so what are the processes in which these substances we use to pass through this barrier, this cell membrane? Now there are three main processes: diffusion, facilitated diffusion, and active transport. Okay, so I believe you know what diffusion means by now. Diffusion simply means when substance moves from a region of high concentration to a region of what? Low concentration through a semi-permeable membrane. So you can see here are the solutes, here are the substances. They are in high concentration on this side of the membrane, and they move passively down the what? Concentration gradient, or along the concentration gradient. No energy is required, meaning no ATP is required. It does not require a carrier molecule, and it is non-saturable. So diffusion usually works for lipid soluble molecules, meaning molecules that can easily pass through the cell membrane, because the cell membrane is a lipid bilayer. So those lipid soluble drugs that are small, they can easily pass through the cell membrane. Along the concentration gradient, no ATP is required, no carrier molecule is required, and it is non-saturable, meaning that it does not get saturated. It occurs till equilibrium is reached. Now, what of facilitated diffusion? Now, if you want to give a patient a drug that is not lipid soluble, let's say the drug is water soluble, that drug cannot just pass through the membrane. It can't diffuse through the membrane. Rather, it will require a transporter. By virtue of that transporter, we say that kind of diffusion has been facilitated. Now, the diffusion is still along concentration gradient, just like this one, just like normal diffusion. Facilitated diffusion is still along concentration gradient. However, now we are using a transporter. Okay, we're using a transporter to move the water soluble substance to the other side of the membrane. Okay, and this method is saturable because this transporter can get saturated, and once the transporter is saturated, no molecule can move again from this side to this side. So we say the transporter is saturated. Now, the last method of movement of molecules along the membrane is by active transport. Now, by active transport here, we use a molecule or a carrier molecule that is coupled with ATP. And in this form, the molecule moves from low concentration to high concentration. It means that we are moving against the gradient. Okay, so we go against the concentration gradient. Okay, and this also is saturable. But the idea is that this is the fastest way in which substances move. This is the fastest way because we are using ATP. Now, again, just to recap, we said there are 3 ways in which substances can pass through the cell membrane, because the cell membrane is a major barrier that drug must pass through. And there are 3 ways they can pass through it: through diffusion, through facilitated transport, and through active transport. Okay, now let's move further. Take note now that absorption has 2 main components. There's what we call the rate of absorption and the extent of absorption. So the rate of absorption tells you how fast the drug is being absorbed, but the extent of absorption tells you what is the amount of drug that gets to the circulation. It is also called bioavailability. What is the fraction of the drug that gets to the systemic circulation? That's what we call bioavailability, and that is what we refer to as extent of absorption. Now, what are some factors that affect the rate of absorption? We said absorption has 2 parts: rate and extent. What are the factors that affect the rate of absorption? Number 1, we have the size of the molecule. Means that the smaller the molecule, the more the rate of absorption. Again, lipid solubility. The more lipid like the drug is, the more lipid nature it has, the more the rate of absorption, because it can easily diffuse. Now, the more the surface area, again, the more the rate of absorption. If the surface area of absorption is wide, then more drug will be absorbed per seconds or per minute. You get, so this one, the smaller the size, the more the rate of absorption. The more lipid it is, the more the rate of absorption. Then the larger the surface area, the more the rate of absorption. Then what of blood flow? So blood flow plays a major role, because if the absorption site is not having enough blood flow, it means it will not be absorbed on time. For example, you are giving drug to the skin and blood supply to the skin has been cut off. Let's say this is our skin and blood supply to the skin has been cut off. The drug will just remain here. And we said absorption simply means movement of drug from the site of application into the blood. So if there is no blood supply, then absorption will not take place. Okay, so blood supply to the absorption site is very, very important. That's why you see that when we are giving epinephrine is the drug of choice for anaphylactic shock. Okay, when we give epinephrine, we don't give it SC, we don't give it subcutaneous, because during that anaphylactic shock, it is a stress condition. So the way the body works is that it will cut off blood supply to the skin, and more blood supply will go to the muscle, so you can withstand that stress. Okay, so blood supply to the skin will be constricted, while blood supply to the muscle will be dilated. So that's why we give epinephrine as a IM injection, not SC. Okay, so take note of that. Now, another factor that also affects the rate of absorption is pH and ionization. Okay, this one is very, very important, because this is going to give rise to the concept of ion trapping. Okay, so I will make it very, very simple. So one thing you know is that drugs could either be acidic or basic. Drug could either be acidic or basic. Now, if it's an acidic drug, most of the time you will see it will be ending with 8. You know, words that end with ATE that are usually acidic, for example, acetate. Okay, so aspirin also is a acidic drug, acetylsalicylic acid. That is the name for aspirin. So you can see acid is inside. Okay, so both aspirin and barbiturate, they are acidic drug. Other ones are still there also. Okay, while for your basic drug we have amphetamine. So you will be hearing things like amine, they usually end with amine. So amphetamine and imipramine, they are what? Basic drug. Okay, now that's one thing you should take note of, that drugs can either be acidic or basic in nature. Now, the acidic drug we ionize in the opposite pH. What do I mean? Acidic drug we ionize. Ionize means they will become charged, they will have charge at basic pH. In like manner, basic drug will become charged or ionized at acidic pH. Okay, so that is one thing you should take note of. That is the rule number 1, that acidic drug will ionize the more basic the pH becomes. Basic drug will ionize the more acidic the pH becomes. So if you put an acidic drug in a basic medium, it will be ionized. If you put a basic drug in an acidic medium, it will be ionized. But if you put them in the same medium, acidic drug in an acidic medium will not be ionized, and it will not be trapped. Okay, it will keep on moving, meaning it will remain uncharged, so you can easily cross through the membrane. Okay, so now the next rule is that once they become ionized, they cannot cross the membrane. That's what I just explained just now, because once they are having charge, they cannot cross the membrane. So if you understand these two rules, then you can understand the concept of ion trapping. Okay, so based on these two concepts, ion trapping is now introduced. So ion trapping simply means when drug or the trapping of drugs as they move between what compartment. You know, drugs usually move from compartment A to compartment B to compartment C. So as they move between compartments, they get trapped in certain compartment depending on the pH, because of pH difference. Because of what? pH difference. Because if the pH in compartment A is different from compartment B, the drug can become ionized, as the case may be, depending on if it is an acidic drug or a basic drug. Let's take an example. Imagine here are two compartments. Here is compartment A and here is compartment B, and I have aspirin here. Aspirin is here. Okay, the pH here, the pH in this medium, let's say it is the pH in compartment A, let's say it is 3, while the pH in compartment B, let's say it is 8. Now, by virtue of aspirin being in a pH of 3, it can easily diffuse, because it is acidic drug in an acidic medium, so it can easily cross through the membrane and come to compartment B. Okay, you know, we said aspirin is an acidic drug. Now it is in an acidic medium, meaning it will be non-ionized, so it can easily cross through the membrane. Now when it crosses through the membrane, it comes to a pH of 8. When it comes to a pH of 8, it will now acquire what? A charge, because I said acidic drug, which is aspirin now, right, in a basic environment will be ionized. So now it will now become ionized. Let's say it will now acquire a negative charge. It means that it cannot what? It can't go back again. By so doing, what do we say? Aspirin has been trapped in compartment B. Is that clear? So what we are trying to say here is that ion trapping is defined as the trapping of drug in compartment as they move between compartment. As drug move between two compartments or two to three or any it doesn't matter the numbers of compartments, but as they move between compartments, they get what trapped because of differences in pH. Okay, now we use this in clinical practice. I believe you must have heard of alkalinization of urine. For example, somebody is on aspirin poisoning. Somebody take an overdose of aspirin. So we need to like cause the kidney to excrete the aspirin out of the body. What are we going to do? We are going to alkalinize the urine. Okay? Because aspirin, let's say aspirin normally will be filtered through the glomerulus, right? And to get into the tubules. So we already know that aspirin is an acidic drug. If I want to make aspirin acquire a charge so that it will not be reabsorbed back into the body, I don't know if I get my point. So now we have, imagine here is our glomerulus. Then aspirin has been filtered. So I will just put this dot as, I will just put this A as aspirin. So aspirin has been filtered. Now, I don't want aspirin to be reabsorbed back into the blood. Okay, what will I do? I will try to make it what? Have a charge. And how will I make it have a charge? Since aspirin is a acidic drug, I will need to make the urine what? Alkaline. So that aspirin will not have a charge. And once it have a charge, it cannot what? Be reabsorbed back. So what we do is that we alkalinize the urine. So alkalinization of urine is used to excrete acidic drug poisoning. When you have somebody suffering from acidic drug poisoning, so you alkalinize the urine. So how are you going to alkalinize the urine? You give the patient sodium bicarbonate, and also you can also give them acetazolamide. Okay, acetazolamide. These are the two substances or two drugs you can use to alkalinize the urine. So also we can also acidify the urine in cases of basic drug poisoning. So if somebody is on overdose of amphetamine, you can alkalinize the urine. In theory, it works because we can give ammonium chloride. We can also acidify the urine rather in order to excrete basic drug. So we can give ammonium chloride. We can give vitamin C. We can also give cranberry juice. All these things we acidify the urine. And if we acidify the urine, it means we cannot pass out or excrete what? Basic drug. But in practice, we don't do this. Because the risk of metabolic acidosis is high. If you are giving the patient all these acidic substances, the body can easily become what? Can easily enter a case of metabolic acidosis, and we don't want that. However, it's important for you to note that in theory it works, but in practice we don't do that. So also note that cranberry juice, based on it can make the urine acidic, we can also use it for what? For UTI. Then to end, I will just give you a definition of bioavailability. Bioavailability is the fraction of the drug that gets to the systemic circulation unchanged. The fraction of the drug that get to the systemic circulation unchanged. Okay, this one refers to the what? To the extent of absorption. So the fraction of the administered dose that reaches systemic circulation unchanged. Okay, take note, is the fraction, not amount. Is the fraction of the administered drug that reaches the systemic circulation unchanged. You know, if you give drug through oral route, the drug will undergo what we call first pass metabolism. Okay, first pass metabolism. The drug will undergo what we call first pass metabolism in the liver, where it will first be metabolized by liver enzymes, and by so doing, some certain amount will be lost from the drug. Okay, so certain amount will be destroyed from that drug. So if, for example, here is our liver, and we give a drug in the intestine of the patient, through the oral route rather. So when that drug is being absorbed from this small intestine, it will first go through the portal tract to the liver. And when it passes through the portal tract to the liver, imagine on this side we have our systemic circulation. Okay, the liver will first metabolize. If, for example, the drug is this big, the liver will first metabolize the drug in such a way that when the drug is passing through the coming out from the liver, it will be somehow small like this. Okay, so this fraction that reaches the blood, is what we call bioavailability. So it is the fraction of the drug that of the administered drug that reaches systemic circulation unchanged after your first pass metabolism must have what occurred. Okay, so in the next video I will introduce you to a concept called Anderson-Ashenberg equation, and we're going to try and solve some questions on it. Okay, thank you very much. Do well to subscribe and like this video. Thank you. See you on the next one.